With all of this data and everything that we have, how are we really using it, or how is the how are the corporates, how are the industries really using it? And this is from a slide share which was presented at a big data conference, right? So finance, I mean, anything around predictive analytics and risk scoring and all these things that we hear about now, and also customer sentiment analysis and whatever you want to do, anything involving statistics to figure out business decisions has always been relevant to the finance industry and to scientists and researchers who are researching on anything and everything, because you need to get your data and figure out whether your theory is validated or not. So these are the two groups of people who have been doing data science. All of a sudden, data science is a commercial fad where e-commerce to social media to everyone wants to do it, right? There are certain things which are useful out of this. There are certain things which are absolutely useless as far as I'm concerned. Okay, so finance obviously is the industry that uses or has been using data processing, and with this entire revolution of big data is able to now definitely be more efficient. So a lot of these videos which you'll see on big data would say that you know it, whether you knew it or not, you have been a part of this big data movement since the last at least 5 years or so. Okay, so this is a very, very potent example for that. So your credit scores when you apply for a loan, your credit card transactions when you're trying to make an online transaction, buying something at an online store or at a point of sale, a retail store. Each of them, they have got certain processes of validation where the transaction event gets bounced from server to server and gets authenticated. During that process, a lot of analysis is going on while the approval is going on. So a lot of you all might have received this, that we noticed that you have made this transaction. Is it really you? Or if you have lost it, please call us and stuff like that. That is a resultant of big data analysis on financial data. So factoids which you have already read, 7 to 10 billion spent annually on technology by each of the 4 largest universal banks, right? They've got about 3.8 petabytes of data. They are, the data includes credit card information, customer information, salary deposit, mortgages, loans, so on and so forth. They are obviously doing a lot of sentiment analysis to figure out whether the customers are happy or not. And also they are doing a lot of predictive analysis, which includes risk scoring and fraud prevention and so on and so forth, right? Now healthcare, this is the industry which I've been really, really close to, so I can give you a couple of examples of what really happens. And this is something which is really, really big, right at the left-hand side. It is a fact that Google actually figured out a spike in people trying to check for flu symptoms and check for flu medicines, etc. Google had actually found out or identified the issue. There is a big issue with flu because there were a lot of people searching on flu symptoms about 72 hours before the Center for Disease Control US. Before CDC could figure out that there was a swine flu, Google had actually figured it out. Now this is something that we have been working with since the last couple of years. So there's something called a syndromic surveillance, right? So all the data that you have from all the hospitals, all the doctors' offices, right, around each person visiting them and whatever the diagnosis is, whatever medication tests and whatever has been prescribed to them, all of that data gets collected right now, or at least when I left, nightly, but we would want to increase that to maybe at least 5 times a day or something like that, so that we can get that near real-time thing, right? So that data, when you get that nightly information from all the hospitals, you can then analyze the entire set to see where there are spikes. Okay, what kind of diagnosis is spiking up for whatever reason, right? So using that, you can actually predict an epidemic before it happens, right? And there was also another project which we are working with the University of North Carolina, where it's quite simple. Like, we see that there are some people from Texas here, someone from Massachusetts, someone from New York City. Each of you all are living at a different set of climate conditions. Obviously, there would be certain resemblances, but the level of pollution based on where you live might be different. The socioeconomic condition diversity, there would be definitely certain diversity in the conditions where you're living at. So be it New Jersey, be it New York City, be it what else? Be it Texas. All of these places have got obviously subtle changes in the environment where you live in, right? So we're doing this where, based on the entire environment of where you're living, and also accounting for whatever has been your own medical history, and also considering your entire family, your parents, grandparents, direct relatives medical history. If you are susceptible to get some sort of a critical disease like diabetes or Parkinson's or something like that, then we can basically, looking at the prescribed way of treating those diseases, suggest certain best practices so that you can basically delay, if not avoid, those diseases from coming to you. And that's huge. I mean, these are really the amazing implementations of big data. And of course, apart from that, the insurance part of it, there is a lot of fraud. There's a lot of other people using someone else's health plan and so on. Those kind of spaces where there are a lot of money that can be saved, right? So those are utilities in the big data industry, right? So you can see, by adopting the electronic medical record, there's a 20% decrease in patient mortality rate, right? There are very simple things, like, let's say you went to a particular I will just refresh that, Sam. I'll see, there might be something. So let's say you have been prescribed some medication at some point of time, 6 months back, and you were traveling at that point of time. If that data is synced to your electronic health record, and you go for a separate visit in a separate situation, 6 months to a year later, and this is a different physician, you are visiting someone else, your regular physician now is trying to prescribe a medicine which conflicts with the one which you had 6 months back. Could be a lot of issues and all, right? So your electronic records can actually be smart enough to raise a flag and tell the provider that this is what was prescribed earlier, and are you missing something, or are you sure, or would you still want to prescribe this medication, right?